Sickle Cell Disease Association of Canada, in collaboration with the United African Women's Association and the Health Association of African Canadians, would like to thank the Honorable Wilson, every MLA, every advocate, for making it possible to have sickle cell in the expanded newborn screening program. Because going forward, every baby born in Nova Scotia will be screened for sickle cell. What does this mean? It means they will receive improved and better care and treatment. Thank you, Nova Scotia. Thank you, Ministry of Health and Wellness. Thank you to the Reproductive Care Program, and of course, Rebecca Attenborough. And we really appreciate you, and we thank you. Mr. John Adams, he's the brain behind a lot of the work we do at the national level, and he's here, and we thank him as well. Thank you to everybody that make it possible to have sickle cell in the expanded newborn screening program. As a token of appreciation, we are presenting the minister with this certificate of accomplishment. And for you to know, this is the first certificate of accomplishment that the national body has ever given to anybody. Thank you.
Thank you so much.
You're welcome.
Thank you.
Thank you.
Thank you so
Thank
much.
you.
Thank you.
Leonard Pereira. I'm the member of the legislature for Halifax, Citadel, Sable Island, downtown Halifax, and I'm also the Minister for Communities, Culture, and Heritage. And it's really great to be back here in this sort of warm confines of the IWK. You know, all of us who've had children will know how many hours we've spent here in anguish and joy, and this place has meant a lot for Nova Scotia families and Atlantic Canadian families, and you know, plays a leading role in providing what the better care sooner for Nova Scotian families. And I'm delighted to be your MC today for this great announcement, and to welcome and introduce my colleague, the Minister for Health and Wellness, the Honourable David Wilson.
Welcome everybody here. So great to see so many people. I know some people have traveled to come to our announcement today, so I'm grateful for that. Thank you to the IWK and for hosting us again. As Leonard said, this is an amazing facility, not only for children and families for Nova Scotians or in Nova Scotia, but for the whole Atlantic region. We know how important this facility is to the health care of children and women across the region. So we're so glad to be here. As Leonard said, this place means a lot to a lot of people, not only for the joyous times, but for those who find themselves dealing with a health emergency or a health diagnosis that is critical to the well-being of their child. So as a parent of 2 children, I know the anguish and the excitement and the nervousness of being a new parent. Especially one of the first things you think about when you find out you're going to have a child is you hope you have a healthy child. And as part of what we've been doing over the last number of years, the important work of trying to get our finances in the province back to order, it's so important because it allows us to look at new opportunities. New areas of health care, for example, which consumes over 40% of the provincial budget. But we need to continue to look at new areas where we can help and support families across the province. So I'm so glad that we were able to introduce a balanced budget this year. It allowed my department and our officials to look at new opportunities. And I want to thank the people here at the IWK who work extremely hard, all the clinicians. And I could try to announce them all, but I know I would miss some discipline within the healthcare field. As a former paramedic, I know often we were upset when they didn't say paramedic. So I won't start naming all the healthcare providers who provide the service here at the IWK, but there's so many of them. And when we look at trying to improve healthcare services, and as a minister in a department, we look at experts. So we had a panel of experts, a committee, come together to try to review where we should go in the future. And should we add new newborn screening tests and procedures here at the IWK. So I was glad to get a report in January, early January, that recommended including and expanding the newborn screening process and those diseases that we are looking for to try to support the family even more. So I'm glad to announce in our budget, I'm trying to think how long ago was our budget? We introduced it.
Seems like a lifetime away
It
now,
is.
isn't it?
About a month, less than a month
Less
ago.
than a month ago.
That we will be expanding the newborn screening component here at the IWK, and I look forward to the professionals here supporting families who come through the doors of this facility. So we're glad to expand cystic fibrosis screening here at the IWK. We're glad to expand to sickle cell anemia screening here at the IWK, and 8 others, including the 13 that we already do. And many of them I can't pronounce, so that's why I'm going to stop at cystic fibrosis and sickle cell anemia. We know it's important, and I want to thank the associations who have been pushing for this for a lot of years. I want to thank the families, the children who have been advocating for us to look at this opportunity, and I'm so glad to have some of those individuals here with us today. I know Leonard will make mention of them a little while later. We know cystic fibrosis has an impact on an individual's life, and we know the damage it can do to your lungs and the potential of trying to detect that early means, I think, a longer, healthier life for an individual. So we're so glad to be able to offer that here at the IWK in the coming months. Sickle cell anemia, of course, another area that we need to try to find early detection. We know historically those with African descent seem to be more prone to sickle cell anemia, but as was stated earlier, was stated to me, sorry, it wasn't in this forum, any child here at the IWK will be screened for these ailments, and I think that's so important. So with that, I know it's more or less informal settings here. I think it's just so important that we recognize those professionals who work extremely hard here at the IWK and throughout the province who support families. And that's the key. We're trying to bring forward initiatives in the Department of Health that focus on supporting families across the province. And this is just one small component of that. And I know it means a lot to a lot of people. So with that, I'll allow Leonard to continue on. We'll hear from some more people. But again, thank you so much for all the support and really the drive to make sure that you caught our attention, but you caught the attention of the healthcare providers who know how important it is to expand programs around the province here. So thank you for that.
Sickle cell anemia is also important to a whole number of different groups, and not just for self-interest, but also it's nice that we'll be able to serve so many more families. I know we all pray to have happy and healthy babies, and you know, if you aren't going to have a happy baby or a healthy baby, certainly even in the short term, this is the place to be. The IWK has just provided such great leadership right across the region, and you know, certainly if you are worried about the health of your baby, early identification, detection, treatment is the way to go. So it's a delight to see this movement in that direction. And also, as someone who teaches at a university, it's great to have the research and the information that will allow us to make better decisions, more informed decisions. And I think the data that we get out of this early screening will be useful as well.
It's wonderful to be here. I think this is a very historic, important occasion for all Nova Scotians. And I know that for many years I've been hearing from people who work in this facility about the need to expand the number of screens that we do. Dr. Gillespie is here today. He certainly has been a huge advocate for this. And my friend and colleague, Dr. Dorothy Barnard, who has retired, would appear at my office at least once a week and say, why aren't you doing more? Why can't we get this done? It was near and dear to her heart. She actually decided to do a PhD when she was retiring, go figure. And her first work had to do with looking at African Nova Scotian populations and the need for sickle cell testing, or just awareness in that whole community. So she's not here with us today, but she certainly helped with my literacy in this whole area. So as the minister has said, this is critically important for families to know and to understand right away that there might be an issue for which intervention will make a real difference in the future health of the child. So the two tests that have been mentioned, of course, are the high-profile ones, but there are many other, the other 8 are equally important as well. So great start, or great building upon what already existed, and we're very, very pleased that the minister is here to make this announcement today. I want to say thank you to all the staff in those departments that have tirelessly advocated for increasing the number of screens for newborns. So thank you all. I turn you over back to Minister.
I'd like to now introduce Winnell Jackson, and Winnell and her son Kynan have joined us today to share, their family's experience with sickle cell anemia. Thank you for.
Thank you. This is Kynan. He just turned 9 on Saturday. When he was 4, he got diagnosed with sickle cell. So for the first 4 years of his life, the first time that we noticed something was actually Christmas Day, and he was going through a lot of shaking, and brought him into the IWK. They've been great. We weren't quite sure what was going on, so there was a lot of, he might be lactose intolerant, and they'd come and they'd give him an enema. Well, I was saying, okay, I don't want to waste their time at the IWK, so I'd go off to Sobeys and get the enema and do it myself. And he's been in and out of the hospital. We've used lactose intolerant milk, soy milk, and stuff like that, just trying to figure out what was going on with him. He finally got diagnosed at 4, and he's been in and out of the hospital since then. But I'll give a big shout out to the hematology on the 6th floor, because they've been great. He's on medication. It was a year ago, his birthday, that he was hospitalized. It's been a whole year since he's actually been hospitalized, which is good. He doesn't have one of the most serious cases of sickle cell, but for the first 4 years, it was every 2 months something was up, which I now realize was a sickle cell crisis he was having, but at the time he wasn't diagnosed. So I think this newborn screening from the get-go, you're going to know what's going on with your child. It's going to be a lot of stress relief for the parents to know, and any complications that, because he wasn't properly diagnosed and he probably wasn't properly medicated for the first 4 years of his life, the other parents, you know what, they don't have to worry about that. They're going to know right away. And I just think that it's a wonderful thing that's going on, and for those other sickle cell patients out there, and unfortunately the new ones that will soon be born, at least they'll know, but there's no better place than the IWK to take them. Not that I enjoy being in the hospital for weeks on end, but the hematology, the 6th floor of hematology has been great. The staff there has been great, and I want to thank the minister and you guys over there. I know you did a lot of work on it. Just on behalf of the new children that come into this world that will have sickle cell, what an awesome thing to have right from the get-go. So, thank you.
I also would like to acknowledge and introduce Stacy Nurse, who's here with her daughter, Karis. They have joined us this morning to talk about their family's experience with CF, with cystic fibrosis.
Firstly, we wanted to say thanks to all the advocates and supporters of the expanded newborn screening program, from the CF community to the leader, Cystic Fibrosis Canada, and of course the provincial government for accepting the proposed expanded newborn screening program so quickly. Secondly, we are so relieved that families in Nova Scotia will now have the opportunity for a fresh start when their children get diagnosed with CF early in their lives. We did not have that opportunity back in 2006 when our daughter Karis was born. It was not until 18 months later that she was diagnosed with CF. It took months and months of speculation, stress, worry, and many doctors and specialists before it was determined that she had CF. Once you become a parent of a child with CF, you quickly realize that prevention is the only treatment. Therefore, it's crucial that children get diagnosed early on. Lastly, we wanted to say, because of the expansion of the newborn screening for CF, it'll give all children a better chance from the start, and now parents will be able to access the treatment for their children right from birth. An early diagnosis could avoid early damage to the lungs, which inevitably can lead to a healthier and longer life. This is what all parents want for their children, the best opportunity for a successful life and future. Thanks.
We have a number of groups here. The CF Association the Sickle Cell Association, a number of IWK staff are here, Reproduction Care Program of Nova Scotia, the Black Cultural Association, Emmanuel First Baptist Church, Capital Health staff, Canadian Blood Services, the United African Canadian Women's Association, the Health Association of African Canadians, the North End Health Centre, the Immigrant Settlement and Integration Services, and departmental staff. And I'm sure there are other groups and individuals here that I haven't acknowledged, but if you are here, you can tell us, because I'm really doing this because there are media and other people around who might want to talk with you. Other than that, I think my work here is done. I want to thank everyone for attending. I would like to thank the Minister for the great announcement, and the staff here, particularly Anne, and the families that are here. The participants and the Minister, I think, will now be available to answer questions if you have any around the table or from the media. Thank you.
So, Wilma, it was nice meeting you, and I heard, you know, when you spoke up there, you talk about the importance of the newborn screening for every baby born in Nova Scotia. Now that Nova Scotia will implement the newborn screening, what else do you think the babies and the children living with sickle cell in Nova Scotia need that the National Organization for Sickle Cell Disorder can work on?
For me, I think maybe a lot more knowledge about what's going on, like how to deal with it. And certain things to look for. Certain things to look for, you know, like when he's about to have a crisis, because we know that they're never going to stop, but the medication, I think a certain medication is really helping.
Yes.
So I guess just more, mostly just more knowledge, more awareness, more, I don't
around
know,
the disease.
About how to handle, how to deal with it, how to prevent it, so that, you know, maybe something you can do ahead of time so that it doesn't become a serious crisis that he has to get to the hospital.
So education.
Education, yeah.
Awareness and education is huge. Awesome. Okay, and also you talk about medication. Would that be something like hydroxyurea that, you know, you think?
They put him on that, I'm not quite sure of the timeline, but maybe about a year into after he was diagnosed. And that seems to, and as they told me, it's not going to prevent him from having a crisis, it just prolongs it between.
Yes.
And he's gone a whole year now. It used to be every 2 months. He's gone a whole year now without having to be hospitalized, whether it's because his body is able to deal with it better. But I think the hydroxyurea medication, to my knowledge, and I'm not a doctor or a nurse, but appears to really have helped, because I've seen such an improvement in him since, you know, when he was younger to where he is now.
Okay.
Yeah.
So I think for many of the patients, the hydroxyurea, you know, from what we've seen, has helped a lot of them. So from what you're saying, we have to encourage the group here to get into education and awareness programs to help parents know what to look for, and probably to also prevent,
exactly,
you know, the children from having the crisis episodes,
right? And,
you know, and how they can live healthier and stronger.
I mean, and there's been a few people I've talked to that, you know, have done a good job. They've said, you know, you can't really, and nobody wants to prevent their child from doing anything, but it's always good to know, okay, is there anything that I should avoid, or is there a certain food? Now, we know extreme temperature changes and things like that can, you know, trigger a crisis. But with Kynan, he really likes to swim, and that's his big thing. He's a swimmer. Now it becomes difficult, you know, going out from the water. But, you know, as a parent, I don't want to discourage it. But if I know there's certain things around that so that he can still do what he loves to do, but I can make sure that he's gonna, it doesn't encourage, you know, and trigger the crisis or try to prevent it. So things like that. Yeah.
Great. Okay, we will work on those things.
Okay.
And thank you.
Thank you.
It's really nice meeting you,
and
meeting
as well.
My young man over there. I know you love your games, and we will try as much as possible to make sure that you know, he has, you know, her healthier, you know, longer lives. Whatever we can do to make that happen. The association will help the group here to make that happen for every child in this province. Thank you again.
Thank you.
Thank you.
Thank you.
Kaya, I'd like to shake your hands. Thank you.
So thank you.
Thank you very much.